tell us a bit more about grief therapy? I'm thinking that there might be people out there who've had a bereavement, or perhaps they know someone who's had a bereavement. They're thinking about grief therapy, but they don't really know, what it is, what it involves, what a session might consist of.
Yeah, and there isn't a template, if you like, Liesl. But what I would say is really, really important is when you're looking for somebody to work with, if you are grieving, make sure you find someone who really is grief informed. I know the NICE standards and guidelines, I think it's 2012 in the UK, maybe it's 2009, I don't remember, would say that, we need to do at least 100 hours of grief education as part of our undergraduate degree, and then at least 12 hours of, grief CPD work every year to keep on top of it. Most of us don't do that. Most of us don't have that. Unfortunately, in many educations for counselors and psychotherapists, they're still learning stages of grief theory, which was never meant to be a grief theory in the first place. And there'd be no talk of, Strobe and Schutz's dual process model, or Robert Niemeyer's narrative therapy and meaning making, or some of the task models of grief, William Worden's work, certainly disenfranchised grief or ambiguous loss. There's so many theories and types of grief, and most people are working on a very outdated stages model, like I said, that was never meant to be for grief at all. So when we're looking for a grief therapist, we need to make sure that we're finding somebody who's educated, who has done additional training, and who understands grief. And for me, this was really important to me, that if I was going to work therapeutically, that I really understood the area that I was working in, which is why I went and I did a master's in bereavement studies to fully understand as best I could this landscape of grief. Because while all our grief is unique, we're also very similar, and the more people that I support, the more I see, we are so similar as humans, and there's nuances or things that are different about our stories, but our human animalistic, mammalistic response can often be very, very similar, and sometimes even predictable. So to be able to work with somebody who really has an idea when they meet you what might be going on for you, and then with you to make meaning out of your experience, is really, really important.
That makes perfect sense. I'm quite interested in hearing, in some ways, I know that every client is unique, and you might approach people differently, but just to get a kind of flavor of what a session would consist of. I think people sometimes have the idea of psychotherapy, someone sitting in a chair, the client lying on a couch. They might have a sort of vision of a particular form of therapy, but grief therapy is different from psychoanalysis, and it has other techniques and ways of sort of working with the client. I wonder if you could sort of give some examples where you've had permission, or talk about some of the techniques that you've used.
Yeah, and I suppose, this is the way that I work. It's not a generalized grief therapy template. I'm really lucky in that a lot of strands of my life have really come together in the way that I work now. So 20 years ago, I studied drama therapy. I did a master's in drama therapy. So I'm really interested in creative approaches to dealing with any sort of psychological distress. I've also trained as an open floor movement therapist. And that's a body-based approach to supporting ourselves, resourcing ourselves. And then, I have a master's in counseling and psychotherapy, which I'm just completing at the moment as well. So I use all of these strands. I bring them all in with the people that I'm working with. So I could work anywhere on the spectrum, from depending on who's presenting to me and how they're presenting. So with permission, I'm going to share a couple of examples. I've checked out with all of these clients in advance before I share their stories. And that's really, really important that people know that. that I don't talk about my clients generally. And I'm going to just change some of the details just so that they're not identifiable. But in the case of a young couple who came to me a year ago, and their child had just been diagnosed with a brain tumor, it was not looking good, but there was a little bit of hope. When they first presented, they were in absolute shock. So we could just see, I could see in them, their bodies were completely activated. Their ability to think and plan and know what they needed was really, really compromised, to the extent that one of them was going from hospital to work to hospital to work to hospital to work with almost zero sleep over 3 weeks. Now, in that case, I was really quite directive, which you normally wouldn't be as a psychotherapist. Have you thought about talking to your HR department? Okay, they've told you they're going to be really supportive and they'll do what you need, but what does that mean? Does that mean they'll give you 6 months off work, 12 months off work? Will they pay you? Have you got 3 weeks? What does it mean? And I encouraged, the father in this case to actually have a meeting with his HR department and find out exactly what they meant by "we're here to support you." And he did that. And they said, "Oh yeah, like 6 months, fully paid, take it, go, mind your kid." And, in that case, I was kind of working as their prefrontal cortex because theirs wasn't available to them. Making that suggestion of, do you need this additional stress and strain right now? So very directive, very involved, if you like. That's one example of one session. All the way to the other end of the spectrum where, working with somebody who themselves, they're a psychotherapist, very seasoned, very emotionally mature and emotionally resilient, and they need a safe place where they can process their grief. And my input in that case is very little. I'm present, I'm holding space, I'm a compassionate ear, I'm sitting in the pit with them. And for this person, there's a little bit of every now and again questions or wonderings or reflecting back to them. But because she's so in tune with her own emotions and her own grief, has a high level of emotional intelligence, she really doesn't need that much input from me. And actually, to be as directive as I was with the first client with her would be a disaster. So as the grief therapist, I'm constantly needing to check in what is needed here. Sometimes it's counseling, it's really, or coaching even. And other times it's, a slower kind of psychotherapy where I'm sitting back and facilitating a process that they're in charge of. Does that make sense?
It makes perfect sense. And it's really interesting to hear the way you move around depending on what the client needs, and also being someone who can be quite practical, who knows your way around the system and can say, have you asked this question? Have you done this? I'm interested with the client who had the emotional intelligence and, who didn't need as much intervention. Do you think that for her, part of what she needed was a kind of support person, someone who is there where she can feel the grief in a sort of safe space? Like, what is that moment, that designated time, doing for that person in terms of their grief?
Well, it's interesting you say that, because what this person would say to me is, when they see me, they're immediately in the presence of their loved one who's deceased. So it's like the grieving space connects them with the love as well as the grief. And, a lot of the mental health adverts that are out there at the moment say, reach out, ask for support. And that's all very valid. But a lot of people also have a best by date in terms of their ability to show up and support. Many people want to get on with their own lives, or they get a little bit fatigued from being compassionate. Bereaved people can be very selfish and very self-consumed. It's normal. That's not a judgment. We're in survival mode a lot of the time. And for many people who aren't trained as a mental health support person, that can be confusing and difficult, and they may not know what to do. So finding that safe space with somebody who's trained can be really, really vital. Somewhere where you can grieve, somewhere where you can say the unsayable, where you can say, actually, I really am angry with them. I hate the way they died. I hate the way they behaved. I resented that she was sick. I hate cancer. I hate my mother-in-law. It's a space where you can give out about the other people who are supporting you, because when someone you love dies, everything goes pear-shaped. Like everything goes pear-shaped. A lot of your close relationships go pear-shaped as well because of your nervous system and your activation. People can piss you off and upset you or say the wrong thing, invalidate your grief, not be able to join you in your grief because they're uncomfortable with their own sadness or their own grief. And so it's really important to have a space where you can go and process all of these relational difficulties and all of these secondary losses as well. A really important factor of grief therapy is it's all that fallout. When someone dies, the fallout, so you can have this primary loss that's devastating. But like I said, it's the fallout that can come in the other relationships, in your faith. Like, I used to believe in God, like I don't believe in that anymore. Or, the universe will provide. Well, God, look what the universe has just gone and done to me. So people at a really profound level, or, at an existential level, can really go into crisis. Gosh, like, why do I even want to live if we're just here and then we die? Like, what on earth is it all about? And people can really go into existential crisis and have, like you say, these big questions that most people can't really hear. Most people might say, well, oh gosh, don't be talking like that. Or, you need to go out for a walk, or they try to fix it or offer advice. So to be able to sit with someone who's literally questioning, why would I want to live if this is all that's at the end of life? To sit there without solving it or fixing it or rubbing a salve on it, to sit with that intense pain, which can manifest as anger or distress or shutdown, and just to sit there and patiently bear it. We're bearing someone's grief with them without trying to make it different.